with Dr. Benita Zahn.
Welcome. Say vaccination these days, and most people think about the scramble to get an appointment for the COVID vaccine. But primary care physicians are also thinking routine vaccinations, especially for children, which have been put off during the pandemic. Dr. Anthony Marinello, Chief Medical Officer for CDPHP and longtime primary care physician, joins me now to discuss why this is a problem and how it could affect the health of your child. Doctor, thanks so much for being here.
My pleasure.
So I know a lot of parents have been worried about going out, going to a physician's office. It's all tied into the pandemic. What's the ongoing issue if kids are not kept up to date with their vaccinations?
Well, certainly there's a public health issue that we need to worry about when children are not vaccinated in a timely manner. It puts people at risk in the community for example, whose immune response has waned over the years. So it's very important for children to get their immunizations on time.
And for those who have fallen behind, what kind of catch-up plan should there be? Well,
first, I would recommend they consult with their doctor. However, there are established catch-up vaccination schedules that are published by the American Academy of Family Practice as well as the American Academy of Pediatrics that could accomplish the catch-up in a very organized manner.
There are some who point to the lack of flu in the community as saying, well, we're doing such a good job of social distancing, masking, that, we don't really have to worry about those other diseases. And the one I want to point to specifically is measles, because we've seen outbreaks as parents have become loath to vaccinate their children against that disease. So do we have a little bit of buffer space with the delay in vaccinating because we have this social distance space?
Not really. The social distancing has helped, I think, most effectively in flu in flu, because those rates of flu are very sporadic across the state. But those other diseases are still in the community. In fact, when I was the school physician at Shenendahowa Central School District, one of the first problems I encountered was a measles outbreak.
Mm-hmm. And that we may still see that despite the masking and the social distancing and the at-home school?
Absolutely, because it's still out in the community.
So these are things to take very seriously. Is there anything else that you're concerned about as folks have been loath to go to the doctor as we start looking down the road?
Well, besides the lack of childhood immunizations, of course, adult cancer screenings are a big concern. The rate of colon cancer screening and breast cancer screening, as well as cervical cancer screening rates are all down because of fear of being exposed to COVID in settings where those studies are conducted.
And that's the concern. And we talked about that on this program. So how do you convince people that not going for the screening is more dangerous than going?
Well, I think it's a combination of our initiatives with our Don't Delay Care program, and that seeking care is safe, as well as with the communications we have with our primary care network to reinforce the need to get those health maintenance screenings in the adult population.
Before I let you go, I want to go back to flu for a moment. There was a big push to get people vaccinated for fear of the twin-demics, as it was referred to.
That is correct.
And it appeared to be very successful. Many people did get their flu vaccine. And then again, with all the precautions we're taking for COVID, as you pointed out, just sporadic. Do you have a concern that go out 12 months and people, actually even less, people say, well, it wasn't bad last year. I don't need that vaccine. I don't have to take that flu shot.
Well, I think it's going to be our job to remind people that the precautions we took for COVID helped reduce this transmission of flu. But hopefully at the end of this year or the beginning of 22, we'll get a sense of more normal behavior in the community where social distancing and masking may not be required. And we would anticipate flu incidence to increase sharply.
And does this tell us that flu responds better, if you will, to the precautions outside of the shot, you know, the masking, the social distancing, than perhaps COVID does?
I think it's very clear that because flu is sporadic, that it responds well to the measures that we're doing in the community with social distancing and masking. But let me not forget to remind people that flu vaccination is extremely important still, and would encourage our members to get vaccinated for the flu, even at this point in the winter.
Dr. Anthony Marinello, CDPHP, thanks so much.
Thank you very much.
And thank you for taking time to be with us. If you want more information on childhood vaccinations, you can check out the link section at WNYT.com. Till next time.